Good morning, Ben, and I'll tell you, the heat index recently is no joke. It can be especially dangerous for the elderly, infants, pregnant women, or those with heart conditions. So I'm standing here in front of Memorial Hospital emergency room. The CDC says last year about 120,000 people went to the emergency room for heat-related illnesses, and one of them was our news director, Kathy Weidman. She spent a day outside in the sun last August, and things went real bad real fast. I spoke with her and asked her to describe the moments leading up to her event. Please stop what you're doing and listen.
I felt like I got hit by a block of ice in my face. I can still remember what that felt like. I had trouble breathing, and I felt like somebody had done this on the side of my neck, and it just continued to be there. I never had any pain in my chest, just in my neck, and then going all the way down my arm. And when we got to the hospital, I started to feel fine in the car, but when I got out, I took a step and couldn't take another one. After a couple of, blood tests, the nurse came in and she put nitroglycerin on my chest, and I said, am I good to go? And she said, no, ma'am, you've had a heart attack.
And it can happen just that fast. Now, the doctors did deem that her heart attack was encouraged by her environment, and that includes the heat. So let's talk about some of the heat-related illnesses so you can spot the symptoms and know what to do. We're going to start off with heat rash. Those are basically very small blisters. They look like small pimples. What you want to do is you want to keep that cool and, most importantly, dry. Use powder if you need to. Sunburns we're all familiar with. You're going to see tender red skin, maybe some blisters. You just want to get out of the sun, apply as much lotion or aloe as humanly possible. And then there's heat cramps. That is associated often with activity or exertion outside. You're going to get heavy sweating with that. You want to stop the exertion. You want to drink a sports drink or some fluids and see a doctor if those cramps persist. Now we're going to move on to the more serious illnesses. First, we'll start off with heat exhaustion. That presents itself as dizziness, nausea, headache, weakness, maybe an unsteady gait a little bit, muscle cramps, and fatigue. Now, heat stroke, you're going to get all those symptoms, except you're going to see more mental symptoms as well, like confusion, delirium, maybe combativeness, even some seizures, a loss of consciousness. Fainting is a problem. The main thing with heat stroke is you're going to have that high body temp of over 104 degrees. You need to call 911. Heat exhaustion and heat stroke can be medical emergencies. So the good news is that heat-related illnesses are entirely preventable. We give you hints all day long about staying cool, and we want to make sure that you are informed as to what the temperature and the humidity is going to be. So we have more information for you on our website, WSAV.com, and of course, pay attention to our weather, people. I'm going to send it back to the studio for now, but I'm live at the hospital on your side. Guys.